negative emotions are demonized. We want to make the pain go away, especially when it's somebody you love. Like you don't want to see them in pain. It comes from a good place, but the path to hell paved with good intentions kind of thing. I hate the way that the psychiatric system has diseasified all of these human experiences. Like I'll hear the descriptions of things that they call disorders, and it's like, that just sounds like a person having a bad day.
Hi, I'm Dr. Joseph Wittering. I'm delighted to be joined today by Matt. Matt's really kindly agreed to share his experience with psychiatric medications. He got started on them, and then things kind of went from bad to worse, and he ended up with some pretty nasty side effects, some of them still enduring today. And he really wanted to come on and just talk about his experiences, kind of getting on medications, and then kind of how things snowballed out of control. And and he has a lot of really good insights on that. So, Matt, thank you so much for coming on and sharing your story. And I'll let you jump right in. Maybe you could just start, like, how did this whole thing begin?
Sure. Yeah. Thank you for having me. So this whole journey began when I was 17. At the time, I was experiencing waves of really rough depressive symptoms, experiencing some suicidal ideation, and in between those periods, just intense anxiety, and it kind of went back and forth between them. I think there were a lot of factors at play that I didn't recognize at the time, but looking back, make a lot of sense. I've got a fair amount of trauma in my upbringing. I've been through a lot of really intense and terrible things. So I definitely think that unresolved trauma is responsible for a lot of those things, for at least myself. But I don't know, I never really considered any of that at the time. I also, about halfway through high school, I started to, drink at parties with my friends and smoke weed from time to time. And I didn't realize at the time, but I'm a really, really, really sensitively, chemically sensitive person. And that kind of stuff has a big impact on me. I think it affects everybody differently, and you can't really, use blanket. It's like you can't lump everybody in the same way. Because I remember when I would smoke weed as a teenager, I would vividly hallucinate and like visually, wow, audio, all of it, and my friends would tell me that doesn't happen on marijuana, like that's not possible, and they'd be smoking the same stuff, so it wasn't like it was laced and I was getting bad. Anyway, I think everybody responds differently is the point, and in retrospect, I think all of that stuff was kind of chemically putting me into a lot of those depressive and anxious spells that I would get, combined with stuff going on at home and school and whatnot. It kind of just created this perfect storm. And honestly, because compared to what's happened since getting off of these medications and what I experienced on the medications, all of that seems like a cakewalk now.
Wow.
I would consider that comparatively to what I've been through as side effects of these drugs, that was all very minor stuff. So I'm not anti-med. I can't make decisions that are right for anybody else but myself, but I just feel a responsibility to share what can happen with these meds and encourage a movement toward disclosure, informed consent, and I think that the way that these drugs are handled is really unsafe, and so that's kind of my intention with sharing my story.
That's great. So tell us, so how did all of this start, with the medications? Walk us through, when you started getting on them, and then when things kind of turned on you.
Yeah. So, it was right when I turned 17 is when I was diagnosed with, I want to say, generalized anxiety and maybe some sort of something depressive. I forget what the exact coding or diagnosis that they gave me was, but um, I don't know. It started with going on a low dose of Prozac, and I remember just feeling very like intuitively. I'm a very intuitive person, and I just there was always something that felt off about the whole thing to me. I didn't really buy it when they were telling me how these drugs worked. Um, based on my previous understanding of drugs and building a tolerance and all of that, I didn't understand how these drugs could be different. And I asked in the office, like, what's the difference? But like, how is this not going to addict me to it for life? When it's, like, why isn't my nervous system going to get used to it like other drugs and need more, for the same effect? And it just kind of, I don't even remember what he said, but it was just like, it felt like somebody making stuff up as they went along. And I don't know, it just never sounded legitimate to me. And
They say stuff like, "Oh, don't worry, these things aren't addictive." Oh, yeah, there might be a discontinuation syndrome, but it's just like a couple of weeks and you should be fine. That's usually like the line that's said at the time. So
yeah,
and
it was
and
stuff
that's
like that.
completely like not realizing that to everyone who's not like a doctor in this little niche, like a drug being addictive, it's synonymous with it being dependence forming. That's what you meant. You're like, I don't want to become dependent on this thing. I don't want to need to be taking higher and higher doses.
Yeah.
And so it's this like two-step they do, which is kind of shifty to like almost make it seem like, oh, nothing to worry about here.
Yeah.
So
And
yeah, it's probably what you felt.
it feels very much so like entrapment, and I don't think everybody does it on purpose. I don't think every psychiatrist is like a bad person trying to addict people to drugs. Like, I'm not on that bandwagon, but I do think that there's a lot of lies in the system. I think that most of the information being provided on the way these drugs work is from the pharmaceutical companies selling the drugs, and therein should lie, a red flag, a conflict of interest for a lot of people. But anyway, it's just, I think it's a dangerous game that is being played. It has destroyed the past several years of my life, and I'm starting to get my life back, but we'll get to that. So I started with the low dose of Prozac. I really didn't buy it when it came to like non-habit forming, and they told me that I would be on it for a year maybe, and then they were gonna bring me off of it. Anyway, I didn't really notice any kind of, I don't remember, to be quite honest, because it was 10 years ago. I don't remember all of it. All I remember is feeling more tired and not really feeling any kind of improvement in most of my symptoms, which were, anxiety and depression. It didn't feel like it helped. It just felt like something I was told to take, and so I did. About a year and a half into that, no one had brought up with me any kind of a plan to take me off, like they said. I barely saw the psychiatrist ever, and I just kept getting prescribed the pills. So I was, holding steady. I think it was 20 milligrams at the time. And then I moved to California to go to college in a suburb outside of Los Angeles, and I didn't find a psychiatrist when I moved. And at that point, I was I was an 18-year-old child, basically. Like, I didn't, I didn't like know how to do laundry and make my own doctor's appointments and shit like that. Like, I didn't know how to be an adult. So, I had just gotten to college, and I was very much so growing up. And so I just never bothered, and I didn't want to be on the meds ever. So I just thought, whatever, I'm just done with this. It didn't help. So I just cold turkeyed and I didn't tell anybody. And the anxiety in particular just skyrocketed when I did that the first time. It was like 10 times worse than I'd ever experienced, and still far less than what I'm experiencing today. But it was intensifying dramatically, and the low swings, the depressive spells were getting darker and deeper and more serious, and um, I was having a hard time getting through class. Anyway, my parents insisted that I get back on the meds and that I find a psychiatrist. So it was like winter break, and when I got back to school for the second semester, I found somebody near campus, and I started going to him. Um, he put me back on Prozac. It didn't help at all, and it felt like, especially the anxiety was getting worse and more severe. Um, and I was really struggling to get through school, and finally he just made the decision to switch me very abruptly from Prozac to Cymbalta, and so he switched me with no, there was no kind of like tapering or anything. Just took me off Prozac, put me on Cymbalta. It went from really bad to really like it just kept getting exponentially worse the more we messed around with this stuff. And the Cymbalta, I mean, I feel like it turned me into a different person, honestly. Like I didn't recognize myself or the way I was behaving. It was scary. I still felt like I was mostly in control. Like I didn't feel like I was gonna do anything particularly outrageous in public or anything like that. But my friends and family were saying like, you are acting like we've never seen you before, and it was scary. I felt that was the first time in my life I ever felt bipolar. Was like I would go for the mood swings were like I would be insanely energetic and like on fire, like we got to do stuff, and then just pits of hell, depression, screaming at people, crying. Like it was weird. It was this weird split. Like I could take a back seat and go, this is not me. It's very yeah, it was
And
very
around about this time, I
odd
mean,
kind of.
are you still, dabbling in cannabis every now and then, or is that kind of gone and it's just mainly just the Prozac and the Cymbalta?
No.
Yeah.
Yeah, at that point the cannabis was gone because I
Yeah.
felt like that's not safe to be doing on top of all this. So I finally reached that conclusion, and that was gone. I did, I stayed in communication with the psychiatrist about alcohol, and he encouraged me not to drink too much, but told me, in don't drink in excess of this amount or whatever. And there was still like a legal limit for me. So I don't know. I do think I was drinking from time to time, but it wasn't like constant or anything. It was like socially when I would go to parties or whatever, because again, I was a freshman in college.
Okay, sure.
So I was involved in that kind of stuff.
Did you ever stabilize on the Cymbalta, or was it just this kind of like mood swings, like ever since you were on it?
It kept getting worse. I never
Oh,
stabilized. It kept
okay.
getting worse. New symptoms were popping up. I suddenly started to have serious insomnia, which I never had. Um, yeah, that came up. Uh, the anxiety was intensifying dramatically to the point that he finally put me on. This is when I got introduced to benzos. So yeah, I went on Ativan as needed, but I had an understanding of how drugs work, so I never wanted to um, become dependent on it. And the first time I took it, it was like the best high I'd ever had in my life, and I didn't take much. I took what I was prescribed, and it got me insanely euphorically high, and I was like, okay, this could be a really big problem for me, and I don't want to because he told me like, this is how much I'm giving you a month and it's never going to exceed that. So I knew like, I can't get addicted to this. Like he's not going to be, shelling these pills out. I've got to keep this in check because this is not like, there's a ceiling on this. So, and I didn't want to, be popping the pills all the time. So I would be very careful about when I took it and time it around things that I needed to be at my best for. Like if I had some kind of a social gathering I was going to, or, something with school that I really needed to be at my best. Like I would save it for that and then not take it the rest of the week and be in horrible withdrawal. Like honestly, is the way I look at it now. But yeah, it was just, I didn't have a baseline. There was no like concept of a baseline at this point. I was so all over the place all the time. And it just kept getting more intense. And then, the insomnia got so bad that he put me on, I think it was Seroquel. And the Seroquel made me like go into this like dream state where I would just run around naked, according to my roommates. I don't know. And it was really bad. There are funny aspects of it in retrospect, but it was very dark. And I don't know. I was on those three for a while, and then the side effects got to a point where I didn't know who I was anymore, and I was so scared for my life. Like I felt like I don't know. I felt deep down like something is wrong here. I never used to experience any of this. I got to get off these meds, and so I was having constant suicidal ideation, and I wasn't, I didn't feel safe. I dropped out of school at the end of that year, beginning of my second year, because I could not be there. I couldn't function. And yeah, I dropped out, and a few months later, I checked myself into a psych ward, and it was the most. My times I've been on a 5150 3 times now, all at the hands of these drugs, and it's the most traumatic experiences of my life, other than this whole withdrawal process, which I guess it could be considered part of. But yeah, the times in the psych ward were, I can honestly say, not being dramatic or embellishing at all, I would truly rather die than ever see the inside of a psych ward again. I really mean that.
What happened in there that kind of makes these the kind of the pinnacle in terms of worst experiences of your life?
Each time had a different thing that happened that made it so horrible. The first time I was pretty violently attacked by another patient. There's also, the second time was during COVID, and the hospital made up some stupid thing about COVID making it unsafe to have multiple wings open, as if that makes sense. We're in a hospital, and they closed down a whole wing of the psych unit and put everybody in the same one, ward. So all of the really violent people were with all of the really non-violent people, like me. And I was genuinely afraid for my life that whole time. I heard that same time I heard the nurses talking about me and another patient in Spanish. I don't look it, but I'm Hispanic. I'm half Cuban, and I guess they just assumed I wouldn't understand. They were just dragging us through the mud in Spanish. I remember hearing them say we were lazy lowlives who just didn't want to work, and they called us animals a couple of times, and just looking at us with these really awful looks, and it was just really sad. And the worst thing of all was the way I think I said this at the beginning of or maybe I haven't touched on this yet, but the way that the psychiatric institution, once you are a patient of psychiatry, you kind of waive a lot of things without realizing it. You enter this system in which, like, for example, for me, I started with what I would now consider pretty minor anxiety and depression compared to what I have now, but like I started with that, and then from the moment you become a patient, anything that I started to experience at the hands of the medications was then blamed on me. It was my illness, you know. It was anytime a side effect, and that's what they are, side effects. Anytime a side effect arose, it was, oh yeah, sounds like you're getting worse. You're gonna need more meds, you know? And it was never, like, it never occurred to anybody that, I started taking Cymbalta and then for the first time in my life started to have horrible insomnia. How is that not, like, how does that not cross people's radar, you know? Like, how is that my fault? Like, it felt very victim blamey, like a lot of it. And
Yeah, they don't see
like,
the side effects. Anything that happens to you after you're in the system, they start thinking, "Oh, this is, Matt's anxiety. He's now developed bipolar disorder." You know, it's like everything
Right.
is contained within you, within your pathology, rather than anyone even maybe taking the time to say, "Oh, actually, he never had insomnia until we put him in Cymbalta." I suspect they probably didn't ask that kind of history when you were there.
No, and a lot of it's frustrating because I feel like a lot of doctors that I've met, at least, they doubled down, and I feel like there's a really big ego component in it. Like, I felt like anytime I challenged anything they were saying, they would just get like very like their whole demeanor, or at least, especially like, I'm thinking of one person in specific, but like I just remember the whole demeanor changing, and it kind of felt like he shifted into talking down to me, and like I don't know. I think
You were
there's
just like
this
a
kind of,
troublemaker. I think that's,
yeah.
you start asking questions and then you're just thinking you're trying to make things difficult. I don't know,
Yeah,
imagine.
and it's not
Yeah.
that. It's just like, I don't know. It's a really tricky thing because I understand that there are people that come through the system that, it's hard to speak to or reason with, and everybody's different. I'm not an expert on all of this, but there are so many people that don't need to be drugged into oblivion that are being drugged like crazy, and these drugs are dangerous. There's proof coming out now every day about the neurotoxicity of these compounds. Like, it's not, we're not playing with something light here, and neurological injuries are some of the longest things to heal in the body. Like, I can speak from experience.
Well,
um,
take us there, Matt. So walk us forward from kind of, being on the Cymbalta with the Seroquel to like, walk us forward to like kind of now. How did things evolve from then to kind of where you are now?
yeah, so
Yeah.
just, I'm gonna get there. The last thing I want to say about the psych wards was the reason I brought up the kind of like waiving your a lot of your rights, or like once you enter the psychiatric system, is because the thing I experienced in all three of the 5150s that I was on is the thing they all had in common was forced medication. I was not allowed to deny things. They made it clear to me that they were going to put me on something, and that, they wanted my feedback on it, but that I needed to be on medication because I was sick. And I really believe I was only sick because of the drugs. And the worst part of the whole experience was the second time and the third time. The latter two times, the first time I asked them to switch me from Cymbalta back onto Prozac, and I was willing to do that. I was along for the ride because I still thought maybe the Prozac helped me. And the second two times, they made it clear that I was going to be on something. And anytime I described side effects that these drugs were giving me, once like this is an experience that I've heard from so many people in the protracted withdrawal community. Once you are injured in this way, for some reason, you can even reinstate what you were on, and a lot of us, it doesn't do anything.
Yep.
It's like something happens in your body that just really injures your brain and your central nervous system, and then they will no longer tolerate what you were formerly taking. That's what happened to me, at least. And they wanted to. I told them about the insomnia problem because once I got off the drugs, one of the things that skyrocketed was I wasn't sleeping at all ever. Maybe an hour a night of really shallow and nightmarish sleep. And I was desperate. After a few months of that is why I ended up in the hospital the second time. And they gave me Seroquel for it, and they told me, when I told them, when I take this, it feels like I'm being electrocuted, and it's giving me these like physical symptoms I couldn't really even describe, and I'm not sleeping. I'm lying there in pain all night. And they looked me in the eye and said, that's not possible. That doesn't happen to people. And I was like, just that feeling of like, I'm a prisoner here. I cannot get out of here unless they tell me that I can. And they are prescribing me things that I must take in order to get out of here. And basically, like, I realized very quickly, I'm not getting out of here unless I take these pills. So I just thought, okay, well, I guess I have to take them for a few days and I'll just flush them when I get out. But yeah, I mean, I was in a constant state of akathisia, which I'll get into it later, but like, I was in akathisia the whole time pretty much, and knowing that these meds, I didn't know how I knew this, I just felt it, that these meds were causing that, and knowing that I had to take them in order to get out and that they were going to make it worse, it was like being tortured. And anyway, you were asking about like where this all led and what's happening now.
Yeah.
So about 6 years into the journey, I became very determined to get off the meds. There were a couple of instances that happened, not just a couple, it actually happened a lot. In 2018, there were probably 5 or 6 times that I could not get my hands on Klonopin, no matter how hard I tried. I had a prescription, and because of whoever wasn't doing their job or whatever was going wrong in this broken like communication between my pharmacy and my psychiatrist, like I could not get them to kiss and make up, and they wouldn't talk to each other, and it was driving me crazy. Like for a solid year, I was like, guys, like I keep going to the pharmacy and they don't have my prescription. What's happening? And the pharmacy would say, oh, they had never called it in. And then the doctor would say, we called it in, they didn't answer. So I was like, okay, who needs, like, why am I the middleman here? You know? And I had been on Klonopin for 3 years at this point, every day. And, you know, I'm not an expert on all of the science of all of this, but I know that benzos are not, I don't know if it's all benzos, but a lot of them are not supposed to be used in excess of 6 weeks. So that's crazy to me that I was on them for 3 years. And once I got off of that, I reached a point where I became so fed up with not being able to get these pills. Anytime I would miss the Klonopin for a day even, I would literally like go into like full body, like profusely sweating, shaking so hard I couldn't drive. Um, like there was a couple times I blacked out, like just got like horrible adrenaline tunnel vision and had to like pull over and like just blacked out for a few minutes. And it was feeling really it was feeling very dangerous. And anytime that I missed a dose, and that kept happening because no one would communicate. So I got really, really pissed off about the system of it, and I just started to feel like I was like I would go into the psychiatrist, barely talk to them, and then they'd write me the same prescription as always. And I just felt like I was participating in like a legal drug dealing scheme. It didn't feel any different.
Because it's so transactional, right? It's not like they really
and I was
spent a lot of time with you.
Yeah, these drugs are legal, and it didn't feel any different to me than buying drugs on the street. Like, except it was a lot more expensive because of the psychiatrist's appointment. The doctor I was working with was like only partially covered by my insurance, so I was just kind of like, I'm shelling out a fortune for these meds and not really like being listened to. Like, what am I doing? And so, and seeing seeing the state it would put me in to be off of them even for a day, I felt like an addict, and I felt like I don't want to be enslaved by these meds. So I decided to get off of them, and my doctor told me, "Oh, you're on a small dose of Klonopin. You can just go ahead and stop." And
was that your only drug at the time, or were you still on the other kind of cocktail?
Oh no, I had been on and off lots of different things at this point, but toward the end, for a long stretch, toward the end of my medicated time, I was on Klonopin and a pretty large dose of Prozac, 80 milligrams. So I was on those two things at the end. So I was instructed to cold turkey off the Klonopin. I did, and that was the very end of 2018. First thing to go was my gut. A lot of people call it benzo belly. Suddenly, within about 9 months, I would say, in 2018, I went 9 months, 2018 and 2019, like spanning both. I went from being able to eat just about anything I wanted other than dairy. I've never tolerated dairy well, but I went from that and not really thinking much about what I ate to there were really no foods that I could tolerate for a long time. I was so sick. I was starting to, I don't know, I feared for my like mortality at certain points of this, because I was losing so much weight and so weak and ill. I looked like a skeleton. I mean, I'm pretty thin now, and I was probably 15 pounds lighter than I am now. I looked dangerously sick, and I mean, this is gross stuff, but I don't really have anything to hide here. And I'm just gonna share it. I was having so much diarrhea I couldn't leave home. And it was like, it wasn't normal. It was like on fire. It felt like pure acid was coming out of me, and it was burning my skin, and like it was horrible, incredibly painful every day. That started very much so in the benzo withdrawal, and then simultaneously, other physical symptoms. I would wake up in these, adrenaline night terrors, completely soaking wet, like I had just come out of a swimming pool. Like you could wring out my sheets. I was like drenched in sweat and you know, physically shaking like visibly every day. Couldn't concentrate. Just the anxiety was just unlike anything I'd ever experienced. And
Matt, can I interrupt? I want to ask you more about benzo belly.
yeah,
What would happen to you when you ate foods like you couldn't tolerate? Like, so I know you kind of constantly had this diarrhea. Would the foods like trigger other symptoms or get you revved up in some way? I was wondering if you could share a little bit about that.
yeah, absolutely.
Yeah.
Um, it became impossible. Like I said, I couldn't find anything that I could tolerate for a long time.
Yeah.
Um, so it became impossible to like discern what was doing what. But pretty much everything I ate would bloat me like with so much gas. It was like I'm not exaggerating. I looked like a pregnant, like fully 9 months pregnant
Oh my
woman,
God.
like many times. It was almost every day. My stomach would just be distended like a foot in front of me, and very hard to the touch. I'd be doubled over in public, like just in this horrible pain. A lot of the time, it felt like someone was burning the inside of my body. Like it felt like I felt like I had swallowed like a lit blowtorch, and it was just like going around in circles in there and like
Oh my
burning the
God.
insides of my stomach. Like it literally felt like I was being dissolved from the inside out. Like it was
Oh,
excruciating pain,
yeah.
and yeah, it was. Those were the main physical symptoms, and yeah, just tons of diarrhea, and um, and yeah, like I said, I couldn't find anything that was sitting well.
Okay. Okay.
And I mean, I could literally go on about the gut stuff for hours. I've learned so much. I've found things that have helped. Luckily, I had a smoothie this
So yeah.
morning.
So what?
This is very exciting.
Well,
Yeah.
that's great. Um, well, maybe I'll come back to this at the end in terms of like what you ended up doing for food. But we some people who discontinue the benzodiazepines, they start to pace. Did you know, sometimes it's just the I guess the akathisia, it's a very internal feeling. Some people talk about that restless and never being able to get comfortable, and for some people that's coupled with a desire. Well, it's not a desire, it's kind of a compulsion. You feel compelled to move all the time and you pace around. Did you have any of that going on when you were cold turkeyed from the Klonopin?
Yeah. Yes, I didn't have. It was more just overwhelming anxiety, and then it turned into full-blown akathisia once I got off of the SSRI completely.
Okay.
Um, I think the way, I don't know, I've thought about this so many times, and my theory about what happened with me was I think I'm still healing from benzo withdrawal, 4.5 years out. I really do. But I do think that being on the Prozac and so much of the Prozac, every time I would cut, because I cold turkeyed the Klonopin and then I simultaneously started to taper down the Prozac. And I was on so much of it, I had to go slow because anytime, I mean, my psychiatrist advised me to go even quicker and said, oh, 10 at a time is fine, 10 milligrams at a time. And I told her, like, I can't do that. I can only survive 5 at a time. And anytime I would even make that cut of 5 milligrams at a time, it was like opening Pandora's box. Like, there's too many to list, but like all of these symptoms I'd never experienced for one day of my life ever before this happened. Just it would, I would make the cut and then for 2 weeks be, inconsolable, and then it would peter out, not peter out, like it would diminish a little bit after about 2 or 3 weeks each time I made a cut, and then I would make another because in my mind I was in such a rush to get off these drugs because I was like, look at what they're doing to me. if I can just get off of them, I'll go through a few more weeks of this and then I'll be okay. I'll heal. Um, and so I do think that the being on the Prozac kept a lot of the benzo withdrawal symptoms at bay for a while.
Mm-hmm.
And then once I got completely off of everything, it was a few weeks into being off of everything completely that I completely stopped sleeping, and I was in akathisia pretty much all day, every day. And I will never, ever be able to put into words what the withdrawal from these drugs has been like. It has completely erased my former concept of reality and replaced it with I didn't know it was possible to feel these things, and I feel the need to share that without I'm not trying to be. I'm really not trying to lay it on thick or be dramatic here. We have to talk about this the way it deserves to be talked about, because it is genuinely the worst thing I could ever imagine going through in anything.
Well,
it's the most painful thing.
What was like when you were at the peak of it, coming off the, I mean, benzo withdrawal is beginning and you're still kind of coming off the Prozac. By the way, how long did it take you to discontinue the Prozac? Over what period was that done?
I did it over 15 months, and I thought that was slow. It was not slow enough, in my opinion, because again, I was on 80 milligrams, so it was a lot.
Okay. So you come off the Prozac after, I mean, that's a decent taper, on outward appearance. Yeah. Tell me, what was it like at its worst? When you got really hit, when you came off the Prozac as well. Tell us kind of what those days were like.
It truly, the only word that will come close is it was being tortured in my body 24/7. That's the only way to describe it. It's the only thing that could do it justice, even a little. It's like it was the most excruciatingly painful thing I had ever experienced or could imagine experiencing, and it didn't stop and nothing I did stopped it. It's been on and off like that for the past three plus years. It still happens sometimes. I'm doing better now for sure. I've had some really good windows. People in the community call it windows and waves of the pattern of healing from this. And I have, I've had reductions in some of my symptoms, but they kind of alternate and vary, what's going to pop up on any given day. But the worst of it, when it was all of the symptoms, all at peak strength, constantly, it was torture.
Describe the pain. So I know, just so people can have a sense of the quality of it, because I think the quality of the pain is quite interesting. People say torture and they might think someone, I don't know what they think, but what is it like when your body has turned on you in that way? What does it feel like in your skin, in your insides, in your muscles and your bones? What is that like?
I will list the symptoms because there's so many. I will try to list some of the ones that come to mind. The first thing I'll say is that all of these symptoms, it creates this kind of split. That's the way I've experienced it, is that I have had it has separated my sense of self into two distinct things. There is me that is in my body experiencing all of this, and then there is my body, because it's like you said, it feels like your whole body is revolting against you. And and you still have to exist inside of it. It's a really like it's a mind fuck for lack of a better word.
Yeah.
It's very very dissociative and awful. But the physical pain is, I mean, like I said, the gut stuff, burning, extreme like pressure and gas yeah, just if you've ever, had a bad day on the toilet, like just that pain in your gut, like that, uh, that I don't have a word for it, but just that kind of pain. That was some of the physical stuff. This only lasted like it didn't last that long, thank God. It was mostly in the beginning during like the most acute phase of it, but I would have this severe burning sensation in my scalp and down my neck and into my shoulders. For the first 2 years, especially, I would have this feeling of like electrocution that would start like in the back of my neck and shoot through my arms and like into my core. Felt like I was holding a fork in an electric socket or something. And that still comes and goes, but it's not as bad. Insomnia, this is a really weird one, but like there's this, they call it like in the community, people call it toxic sleep or toxic naps. And it's like, you're so exhausted, your body is like trying to sleep, but I think it has something to do with cortisol. And it's like, you can't, it's like anytime your nervous system tries to calm down, it like triggers the opposite response and like fills you with adrenaline and like this like gasping for air terror. Like that was what kept me awake for so many months in the beginning, was I would not be able to fall asleep. Like no matter how exhausted I was, I would lie there and think all the right thoughts and, try to calm myself down. And I would just, anytime I got close to sleep, I would surge out of it. Against my will. That was another one. Profound fatigue in a way I'd never, I can't compare it to anything because it was so much worse than any other fatigue I'd ever felt. And heart stuff too. There were many months. It was really like the first 2 years I physically could not do much. I didn't work. Thank God I have my family to support me through that time. But I could not function. I couldn't move. Like I was, the most physical activity I could physically handle was moving from my bed to the couch. Like I literally, if I got up to walk to the kitchen to get a glass of water or a snack, whatever the case may be, just the act of standing up, I would frequently black out from standing up. I still do sometimes. And I have to be careful to not stand up too quickly. That I would get so unbelievably dizzy, I'd have to grab onto things. My heart would start racing from the movement of shifting on the couch or standing up and walking a few steps. Just that amount of physical activity, and my heart would race like I was running a marathon. Like it was like I checked, I would time 15 seconds and count my heart rate and multiply it by 4, and it was like it would be like in like the 180 area just from standing up. So those are some physical things that come off the top of my head. There's more, I promise you.
Let me ask you this.
And then
did you have any changes to how you perceived sound, whether it was ear ringing or anything like that? Any changes in your vision, how you could perceive distances or how clearly you could see things or focus on things? Maybe you could kind of talk about how this affected other senses, if it did. Yeah.
Totally, yeah. It absolutely did. It messed with my vision a good amount. It was like the brightness had gotten turned down in one eye, and it was really hard to concentrate on things because, like, I don't know, when the calibration gets off even a little bit, like it messes with your depth perception and just a lot of things. Like visually it became kind of hard to perceive things at times. That's gotten better. It still comes and goes sometimes, but it's mostly better. Overall, the way it affected me sensorially, is that a word?
Yeah.
The most is it just like it took like the threshold of what my brain could tolerate and erased it. It was like everything was too loud, everything was too bright, everything smelled too smelly and tasted too tasty, and like it was too much. Like everything was just amplified to 1,000. It was, and it kind, I don't know, like, you know, I know that there's something like 11 million bits of information or something like that that your brain filters through every second or something. It was like my brain couldn't filter anymore, and all of that stuff was hit. Like, I don't know how much of it actually gets processed through in a healthy brain, but it just felt like too much was pouring in, and my system couldn't adjust, and I just felt like really, really overwhelmed by all of my physical senses.
Mm-hmm.
And by far the worst symptom I've experienced through the whole process of healing from this has been akathisia, and I really need to share about that because it's a crossover. This is like the bridge symptom between physical and mental, because I haven't even touched on the mental symptoms of all of this because they're, you know, more vague, and I think people have a harder time like grasping them, and not just writing that off as, oh, you're an anxious person. Akathisia is, yes, it's like you said, it is a compulsion to move. That's one aspect of it. But it's the most unique pain I've ever felt. There's nothing quite like it. And it's confusing to me because it's so gray area between mental and physical. Like, I don't have words for it, but it centers here a lot of the time for me. A lot of people I've spoken with who have survived it describe it like right under the sternum. And the best way I've been able to put words to it in the past is it's like your body is so terrified. It's this surreal dimension of terror. It's not fear, it's not anxiety, it's complete terror. And it's like that manifests physically into this pain right here, and there are no words for it. So it's kind of like a wind knocked out of you, like an ache almost, but that doesn't cut it. It's absolutely excruciating. And yeah, like that is what would keep me awake for months. That's what I like when I get the terror surges in the mornings, especially still. It all kind of centers here. And overall, akathisia, it's like the highest level of fear manifested in the body is the way I would explain it. For me, the movement is when it's at its worst, it's a must. It's not something you can control. You have to move. And I don't know, it feels like my whole system is telling me like, you're going to die if you don't move right now. You have to walk around. You've got to walk around. So when you see people in the psych wards, you know, pacing around all night long, and you're giving them these drugs, like, you may very well be doing that to them. And people deserve better than this. And so it's just, yeah. I just, yeah, quickly, like if anyone out there watching this is going through that, just survive it. And I'm sorry that it's happening to you because it's the worst thing ever.
Um, that's so interesting that you mention it, that it strikes you here, because one of the most common thing that I hear working with patients with benzodiazepine injuries is they talk about diaphragm pain. You know, they're always saying there's something going on here. I don't know what it is. It's just like there's this tearing, twisting, thing going on underneath it. They also talk about as if someone's like they've been in the playground and someone has just kind of thrown a ball and it's just hit them like right in the gut.
Knock the wind out of you, yeah.
Totally, like there's this like knot like deep in there. But you're right. I mean, the way to describe it is strange, because I've also heard a lot of people feeling like this weird pressure. There's a pressure component, and they say things like, "I'm going to explode." There's like, it's like, there's a car engine just like revving inside me. I know you said that it felt like there was like this blowtorch in you that was just kind of flopping around in there, just kind of, lighting things up. Someone's told me that it feels like there's just like a beehive like within their body, and it's just like this like buzzing. Some people tremble a little bit, but whatever it is, it just sounds like this really strange, never-ending, intense discomfort. Of just like kind of, yeah, like you said, right centered here.
It's not, I want to say quickly, like first thing, it's not never ending, and that's important to say, because there's going to be people watching this that are going through it, and please just know, if you are, it's not never ending. I'm not in it right now, I still go in and out of it sometimes, but it does end, and it is a thing that you can heal from. It just takes a really long time for some people.
Well, tell us about that.
So
How long did you have it for before you finally got like a window?
The akathisia has not been constant for me, and I'm really grateful for that, because it is for some people. There are periods of time throughout the past. I've been off of everything for 37 months now, so a little over 3 years, and there have been chunks of time throughout that it has been constant and relentless. But the first, it's hard. It's really hard to put any kind of timeline on a lot of this as well, because my own journey with all of this has been really nonlinear. Yes, I've been off of like the drugs I was on for all that time. I've been off of those for 37 months. But since then, I've been on multiple rounds of antibiotics, which can mess with all the same receptors, GABA receptors, namely. I was for a year, I think a year and a half of this process, I was on low-dose naltrexone, which they put me on for gut inflammation, which apparently I didn't know until a year into that it can cause psychiatric, like psychoactive side effects, and it does all kinds of stuff to your opiate receptors and causes your body to create more opiate receptors. And like, I don't know what's going on in the nervous system with all this, but like messing with any receptors in any way is a no-go for in the way I look at it. And getting off of naltrexone, I was on 1 milligram, and getting off of that, every time I would cut it 0.25 of a milligram, that little, anytime I made that cut, I was in full-blown akathisia all day, every day, nonstop. And so it took me ages just to get off of that. And oh God, sorry, this is all really heavy.
Yeah.
I had a point, I forgot what I was saying.
I kind of forgot as well, so it's me as well. I think we were talking about when you healed, and then you were saying that it kind of
yes.
came and went for a long time, and then it
Yeah, it's
eventually
just
left.
what I'm
Yeah.
what I'm getting at is it's been very non-linear for me. So it's hard to put a timeline on any of it because I've had a lot of setbacks. I've had a lot of things that I think if they hadn't happened, I would probably be doing a lot better by now. Um, but I didn't know, and that's why I make the videos I make and am, sharing my story and all the details of it because I just want to be able to pave a clearer healing path for the people that are going to walk this after me. I've learned so much through experiencing it.
Can I ask you this? Because we didn't really touch on the psychological, and I think that it's often overlooked. I mean, people talk a lot about the physical stuff, but the psychological component of being in that state is also really important. I know it's vague. I know it's kind of hard to describe. But what is that state of terror like, kind of when you're going through it? Like how does it twist your mind and your thoughts and put you in a hole? Like I know a lot of people talk about suicidal thoughts, end of life. I mean, there's a lot of dark, kind of obsessive like quality that happens during those states. But I want to know your story and what it was like, how your mind kind of, because people say their mind turns on them as well,
Oh
especially,
God,
when
yes.
it's really severe. So tell us about that.
Yeah. It's again, like I could talk about this for a week straight, never run out of topics, because
Yeah.
it's so intricate. But first thing that comes to mind is this has. I won't get into the details on this. There's other videos I have up that I talk about this a lot more, but this whole thing has blasted me open spiritually in a way I didn't expect, because of I don't know what it's put me through has really created a connection to whatever's out there. I don't want to say any words that are gonna alienate any groups of people, but whatever is beyond like all of this, it has connected me to that in a way I don't think I could have gotten any other way, and I am grateful for that ultimately. Um, it got me there because it is so like otherworldly level painful. It's so hellish, for lack of a better word. Um, it kind of there's so many metaphors I could use. Diamonds under pressure, being forged in fire, all that kind of symbolism. It sounds cheesy, but it feels true because when I have gotten windows at this point, like I don't get a lot of them yet, but I have had some, and I didn't really get any for the first 3 years, so I'm glad to be getting them now. It's a sign of healing and improvement. And when I do get them, I had a really good one about a week and a half ago. Um, it's not that the anxiety is gone. It's I'm gonna I think be coping with that probably my whole life. I'm a very sensitive person, but it's it's that anxiety, like a normal level of anxiety that's not being induced by a brain injury is so like it so pales in comparison to anything that these medications have put me through that like it doesn't phase me. Like it when I've had those windows, my same insecurities and fears and whatever, they'll be there, but the volume is turned down so much compared to this injury that mentally and spiritually I look at this type of journey as it's like high altitude training is the metaphor I always use. It's like you are being put in such an extreme set of conditions to work on yourself. It forces you to work on yourself, and so many people come out of this, completely redoing their whole diet and the way they treat their bodies, everything they put in or on or around their body. Like, a lot of people make big changes in these areas. I know I have, and was, encouraged to by people who've walked through before me, that once all of those things catch up, like once all of the work you've put into yourself in trying to heal from this pays off, it pays off in spades. It's like when you're suffering this badly for this long, once you get through it, like, and you don't have to fight for basic everyday life isms anymore,
Mm-hmm.
it feels miraculous. It feels like you can do anything. And so for me, what I've had to do for a long time in this injury is I have had, and it is a practice. And for anyone who's not there yet, that's fine. It can take a long time to develop like a sense of acceptance, because so many people told me this, my mentors, the people I've spoken with in this community who survived it, have encouraged developing a sense of acceptance around all of it for so long. And I have had to do that. It's the only thing that has kept me alive, is accepting that this is going to take however long it takes, and that timeline is different for everybody, and nobody can tell you how long it's going to be for you. But yeah, I mean, like, developing that sense of, okay, surrendering to it, as horrific as it is, has been the thing that's kept me alive, along with a lot of support, and you have to, or at least I had to, create this kind of a split inside of my own mind of like, this is my intention, this is who I want to be, and the things I want to do, and it's not possible right now. It's not, and I would try, I would try to do all kinds of crap that I wanted to do in my life, and I still try sometimes, and you have to keep meeting yourself where your body is at, where your mind is at. Like, it does no good to pressure yourself into trying to push the boundaries of where you are in this healing process.
And Matt, can I ask you something? Yeah. A lot of people going through states of akathisia, they take their life, and it doesn't surprise me because it's so hellish. Did you ever struggle with those thoughts? And then if so, what allowed you to keep on going when you were in the pits, to kind of get to the point where now you sometimes have these windows and you can see, I guess, a bit more the light at the end of the tunnel?
Yeah. It really does come down to it's 1 second at a time. When it's that bad, it is truly moment to moment. Do whatever you have to do to survive. I mean, that's really the best answer for it, because I've had to do whatever I've needed to do in times of akathisia in order to not kill myself. And ultimately, what I find the most vital thing for me in that process has been the support I have from other people. If you know somebody who's in this, understand that, like, I want to say this right. Try to push the boundaries of what you can tolerate from from people in your life that may be going through this, and understand that, like, it is so indescribable what they're dealing with. They may, like, people may act in ways that you've never seen them behave in this state, I have. And what has been so important for me and kept me alive is having people in my life that a metaphor I used in the past is, it's like when this happens, I'm going to burst into flames. Luckily now I kind of can see when it's coming and you know, I guess warn people, or not like that, but I can do what I need to do to like get myself in a place to be safe. And it's like when that happens, I am going to burst into flames whether I like it or not. And what I need, and I've communicated this to the people closest to me in my life, what I need in those moments is people who are willing to put on the flame suit, you know, the flame, you know, the fireproof suit, and, you know, be there with me until I'm not on fire anymore. And I'm so lucky and grateful and blessed to have people in my life that believe me and validate all of this, and have been, you know, the support I've gotten from my friends and family has been life or death for me.
That's what saved your life. It sounds like being able to go through this with people.
Yeah. And that also on my part comes from, you know, being willing to be really vulnerable with people. And I know that not everybody's there, but I would encourage, if you can, like for people who are more reserved about all of this, like try to find, you know, one or two people in your life, even if it's people in the community. And that's why I think the community is so important, is because we all get it, you know, like everybody in the withdrawal world understands just how bad this is. And when I had nobody, you know, when my friends and family didn't understand, because they didn't in the beginning, they really did not get what was going on, and it turned a lot of people away. But when I didn't have that, I had the community, and I had the people I met through Inner Compass, and Inner Compass Exchange. If you haven't heard of it, go check it out. I had, you know, coaches that I worked with that have been through it themselves. Shout out to Angie Peacock. Like I had people out there that's why this community matters so much, is there are people out there who have been through what you're going through and can at least encourage you and give you reassurance that it will end when you're in those dire circumstances. So yeah, ultimately, biggest piece of advice, don't be afraid to lean on people, even if it's people in the community. Find people that you can talk to about it. Because I can't tell you how many times I have been pacing around my apartment until my, you know, legs are going to give out, shaking my arms and crying and waiting for it to stop, and just being on the phone with somebody who is telling me, you know, it's going to be okay, it's going to pass, I'm here, and listening to me. Like, just not feeling alone has been so important.
What a great response. Matt, I was going to kind of segue to kind of another line of questioning about, you know, talking a little bit about how you shrugged off your identity as having like a psychiatric problem. But before I go there, because we're still on the topic of withdrawal and symptoms, I want to pause and see if you have other comments and other things that you want to talk about related to recovery from protracted withdrawal injury.
I don't know. I have nothing specifically is coming to mind. I have so much to say about it. It's hard to pick any ways of narrowing it down, but I guess the biggest thing is just for the people who are out there that want to come off their drugs at some point and are scared now. Please understand, I'm never trying to scare anybody, and also, like, this does not happen to everybody. And if you do it safely, it very well, you know, you may dodge all of this. A lot of people do.
or even
Um,
unsafely.
yeah,
Although that's not advised to do it unsafely, but a lot of people cold turkey themselves and they're fine. Yeah,
yeah.
yeah,
So, don't, big piece of advice for everybody, whether they've been through it or not, don't take on anyone else's story other than your own. Your own. Yeah, it's different for everybody what happens. So that, and anybody going through it right now, just please hold on. And I know that I know better than a lot of people that your brain is going to serve up every single reason in the book that you are the different one, and you're not going to be okay, and you're not going to heal. Um, but I really do believe that we all can if we just keep going,
yeah.
as much as that's impossible to do sometimes. So please just find whatever it is that you have to do to survive this, and you deserve to see the other side of this. You deserve to heal based on what you're going through. Um, you have a right to see the rewards from it. So
Great.
yeah.
So let me ask you this. There's this whole idea, you know, so benzodiazepines, antidepressants, and the rest. I mean, they ruined your life essentially. They threw you into hell, and
Temporarily.
thankfully you're coming out of it now and you're seeing the other side. Um, but there was a time at the beginning where I guess you were willingly taking these medications. You thought, I imagine you thought you had a mental illness, and that's why, and that you needed to be on them. Can you walk us through that process of like how you got lulled into thinking that you had an illness that needed medication, and then what it was like waking up from that, once you were like, once you were in it, because I always think that journey is a really interesting one, about how it even starts, and then because here you are now looking back at it and just being like, that didn't need to happen. And so I always like to think about, and so yeah, I'd love to hear your thoughts on like what you think had gone on in your life and how you kind of got lulled into being on the medications and all of that.
Yeah. I think it's a really multifaceted thing. I think it's the world we live in. I, I just, the way I see it, the society that we live in creates a perfect set of conditions to get trapped into something like this. It's so broad, it's like the problem is so systemic at this point. It has to do with fundamentally, the way we relate to each other and the way we're conditioned and taught about life. Like, I feel like negative emotions are demonized, and especially, I mean, sorry, but especially in American culture, like, it's this, there's this huge, very profitable, so there you have your reason for it, but like there's this huge complex in our society of, um, you know, chase pleasure, avoid pain, and anything you have to do those things that ultimately digs you into a hole, like the way I see it, like, and it's so many different aspects of life. I could get very long-winded and philosophical about this, but like, if you're like, it's normal, it's human to have negative feelings. You're not going to be happy all the time. You're not going to feel great every second of your life. So I guess just like bravely facing those things and teaching each other that it's okay. It doesn't mean you're sick. And like, I hate the way that the psychiatric system has diseasified all of these human experiences. Like, I'll hear the descriptions of things that they call disorders, and it's like, that just sounds like a person having a bad day, or like, or like, or a coping mechanism or something. Like I feel like there are so many human things that get turned into diseases by this system. And yeah, I think that it's important to, like, again, I'm not an expert on everything, and there are so many different manifestations of mental illness, which I think is a bullshit term, but like there are things that are kind of outside of my wheelhouse, but I have theories about a lot of it, and I'll go into that in my own videos. But like, I guess confront your humanity is what I want to say. Like, embrace your humanity and know that life is a challenging thing, and that's okay, and that's, I believe, why we're here, is not to coast and be comfortable our whole lives.
I want to talk about something that was interesting with your story, and this is me putting on my little, like, therapist hat. It happened when you were 17. And so when I think about 17, I think about high school ending, going to college, big expectations, doing well in school, and things like that. And there was a crumb there, and where you mentioned that your parents were worried about you, and it's something that I often hear a lot in other stories, that the people that we love, our parents, they're all conditioned the same way we are. They all see the same ads, they all see the same stuff, and that there tends to be this kind of pressure from our loved ones when we're suffering. They see that we're in pain. They see that it's maybe getting in the way of the things that we want to achieve, and their response tends to be, you need to go and see a doctor, go and see a professional, because that's what you do with everything else. When you're struggling, let's go see an expert. And so I wanted to ask you, in your story, like, did that play a part as well? Family, loved ones, they're kind of also the way that they were seeing your problems and how they thought that it should be handled, that ultimately kind of also led you to going in that direction.
Yeah. The first thing I want to say is I don't blame my parents for any of this. Like, it's not their fault. And yes, they encouraged me into this system, but I also walked into it, and it was a collaborative effort. And kind of broad strokes, philosophical, societal kind of stuff, I think that it's like you said, the reaction that I feel we're all taught in life to have toward pain, negative emotions. You see someone in pain, and it comes from a good place, but the path to hell paved with good intentions, kind of thing. I think that a lot of us, we want to make the pain go away, and we want to, we want to get our love, especially when it's somebody you love. Like, you don't want to see them in pain. But I guess, like, the most important thing to me is we've got to normalize not being okay, like, because that's part of life. The way I see it, it's never going anywhere, at least in this human Earth experience now. Like, it's not, that is part of the gig, it's one of the rules. And so I think, like, my philosophy with all of this is the only way out is through. And my whole practice and online presence that I'm starting is other side wellness, get to the other side. And the only way you're going to do that is through. You're not going to dodge pain. So I think that the best thing we can do as a human race is get used to and get comfortable with the idea that we're going to see our loved ones in pain. We're going to be in pain. And instead of trying to make it go away and not deal with it, moving through it together is, I think, that's where I think the answer is. And
so much of that is true. I see people who have, a lot of the times this is where, like, anxiety and depression can start from. You see people who are they've ended up in dysfunctional relationships, or they're going through divorce, and sometimes there's children involved, and they talk about this deep, crushing, hopeless sadness that they feel, trapped in these relationships. You walk back with them and you realize that they've never really learned how to have healthy relationships. They haven't learned how to deal with conflict. They haven't learned how to deal with the own way they respond to things. And the only way through that is, to get through that is to go through it. Like you said, I mean, you need to be able to almost work with a guide, or find some, listen to that voice inside you, and not kind of rush to figure those things out, because otherwise they just keep on happening. And that's really where severe depression can start. It comes out of just feeling trapped. You don't have what you need to navigate the circumstances that you're in. And some people's circumstances are a lot worse than others. And that's where, things like privilege, and where you grow up, and, the things that you have to go through. Some people get dealt a bad hand, and it's a lot easier to become depressed when you're navigating more problems than other people. So I think that was really nicely said, Matt. And the other thing I wanted to ask you about was, how did you wake up? Because a lot of people, they end up on these medications for a really long time. And I suspect you're going to say something like, yeah, because I had severe side effects, and I was forced to wake up to it. But I want to hear your story about how you realized that you'd been misdiagnosed and you were on the wrong path, and that, something needed to change. Because I also think that wake up moment is also really important, because that's when things change.
Yeah. This could easily get into a long, spiritual discussion. But it is. I mean, that's the answer I have for you. Is it was a spiritual experience for me, and I'm not gonna sugarcoat that. It was very, very profoundly divine intervention. Is the way I look at it. I had a voice in my gut telling me for years, these meds are doing something to you. It's weird. I don't you shouldn't be on them. And I ignored it and kept taking meds and getting churned through the system more and more. And eventually it just got to a point where it was so loud I couldn't ignore it anymore. And then the turning point for me when I made the decision to get off the drugs completely was I was very seriously debating ending my life one night. And I was alone in my apartment, and I really, really wanted to kill myself. And I think I was just on my kitchen floor crying, and something something came into the room, and it wasn't a hallucination. I wasn't hearing anything. I wasn't seeing anything. It was like a sixth sense, something extrasensory happened, and I don't quite have words for it, but something came into the room, and it was like a presence that came all around me, and I just heard in my body, you feel blocked from everything you want to achieve and do in your life, and you don't know how to work through any of this stuff, and you're not going to work through any of it until you get off of these drugs. And then it left. And I had this just deep intuitive feeling that these drugs were stunting my growth, my energetic growth, my spiritual growth, my mental growth, and they were fucking me up physically too. So I don't know, I felt like if I have so much I want to achieve in my life, if I don't do this, I'm not I do feel like the meds really, really stunted my ability to process many things, traumas, insecurities, fears, all kinds of stuff. I felt like it put a block on all of that. So that's ultimately when I made the decision, was really by being in the system and seeing the way it treated me and was treating the people around me. um, I started to recognize it as a big money game
Yeah.
is what it is largely. So yeah, I refused to be a pawn in that. It pissed
Sure.
me off. Honestly, like I've drawn a lot of strength from being angry.
A lot
But
of people do. That's actually a big thing that makes people stay alive. You know, they start going, "I'm taking these guys down." You know, and I guess here you are with all of the energy that you're putting into your new venture as well. Probably some of that's derived by the anger of the pain that you had to go through and wanting to help other people not do the same. Um,
yeah, I really didn't ever want to reinstate meds because once I saw what the drugs truly did to my body, I was so livid and I remain so angry. And I'm trying to work through it now. But I was so enraged by what these people and these greedy fucking pharmaceutical companies did to me for a buck that it honestly became like I'm gonna survive this in spite of you motherfuckers like and
yeah.
you know whatever you need to do if that's something that's gonna keep you alive until you get to the next part, um, all the more power to you, you know.
And can I ask? I mean, this is a bit more personal. You don't have to answer this one if you don't. When you came off the meds, and that's that same thing. Like, what was there waiting for you? You know, when that voice was just like, "Hey, you need to work on this shit." Like, the only way you're gonna need to do it, like, is by coming off the meds. What did you find on the other side that you were like, "Hey, these are things I need to look at and try and work through now."
So
Maybe there were
what I
things that
didn't
originally led to your anxiety and depression. I imagine that might have been it, or maybe it's other things. Yeah.
what this injury did to me, um, it's multifaceted and there's a huge component that is physical damage to your nervous system that is just not fair and terrible and painful to heal from. um, but what it did to me spiritually and mentally was, it took everything in my life that I was not confronting and dealing with and trying to shove under the rug, and it put it right in my face because I don't know. It's like the way I look at it is like all of the trauma, all of the stuff you're not working through when you're drugged so much that you can't stay awake in public. I didn't touch on that, but when I was at the most medication I was on, I literally would fall out of chairs in public because I'd fall asleep
Yeah.
if I didn't have a nitro cold brew in my hand. So yeah, like when you're that comatose, and in that much of a fog, it there's no way it doesn't stunt you from processing, your whatever happened in your childhood and whatever's happening now and your insecurities and whatever. It's like so all of that stuff, the way I look at it is it like dammed up the river and
Oof. Yeah.
all of this stuff was trying to flow and building up, and I use a lot of metaphors, and then take away the dam of these pills, and it just everything from 7.5 years of being on the meds plus everything behind it
Oh God.
came exploding into my consciousness at the same time, and now like ultimately it even though it's been torture, it has been a gift in many ways because I'm acutely aware of the way I work now. I'm still learning about myself, but like I get me in a way I
Yeah.
didn't. I see the way my mind works. I can tell where I'm going that's leading me down a dark place. And it has taken years of this to get to like I'm start again. I think I'm always going to be learning, but I'm starting to get it more. And yeah, it puts it all in your face, and that's the way I look at it. Is like this is gonna be there until you deal with it, so you might as well, you know. Yeah.
Nice. Well, I think it's probably a good time to wrap, but I just want to say thank you for sharing your story. I can tell just by talking to you that you have a lot to offer people who are walking your path, and yeah, you're going to be really like an asset to this space. So can you tell us a little bit more about your endeavor? How people could talk to you, how people could get involved with you, where you think it's going. I think that would be really nice.
Yeah, absolutely. So right now I'm still walking this weird tightrope of like I get windows and I am presently healing. So it's not linear, you know. I have really bad days and I have better days. Today's a little better. The past three were Akathisia city, so you know it's very non-linear. So I'm still navigating it day by day of like how involved and present I can be with the this whole slice of the world. Um, and so like where I'm at right now is I do my absolute best to offer support whenever I can. And I genuinely, like, I'm not being a kiss ass. I really love to be there for people who are in this. I don't love that anybody is in this in the first place, but I feel honored to be able to walk with people through their darkest times, because I've had a lot of help in that department that has kept me alive to where I'm starting to get to, you know, feel some peace sometimes. So it means the world to me to be able to pay it forward and help when I can. But you know, I still, at this point, as I'm still healing, I reserve the right to just be like, I can't.
Yeah.
I got my own stuff going on today. I can't do it. So best way to like get in touch, I guess, is I have a YouTube channel up. It's called Other Side Wellness, and I make videos about different aspects of this withdrawal experience. I haven't made any in a while, but I'm gonna get back on that soon. It's just been a busy time. And I'm always keeping up with the comments on that. There's a link to my hypnotherapy website. I'm a hypnotherapist. There's a link to that on my YouTube channel. It's othersidehypno.com, and my contact info is there. Just please, like, if you need support, I'm happy to be there for you, but please just text or email me first, because I've been getting cold calls lately, and it's fine, but sometimes I'm like, I can't do this right now.
It won't be fine
So,
forever, Matt.
yeah.
You know, yeah, that gets pretty full on. But that's great. Well, you know, I think I'll go ahead and end the recording now. But you know, thanks once more.